In this video, we are going to discuss about malignant otitis externa. It is inflammatory condition which is caused by Pseudomonas aeruginosa. Pseudomonas aeruginosa is a bacteria, so malignant otitis externa is a bacterial infection. Malignant otitis externa mostly occurs in elderly diabetics and immunocompromised persons. Elderly diabetics means those persons whose age is above 50 years, and immunocompromised persons include the category of persons who are suffering from HIV or those persons who are taking steroids. Now we will discuss the clinical features of malignant otitis externa. In malignant otitis externa, there is severe ear pain and there is a granulation tissue in the ear canal, and there is also a facial paralysis. Now, you have to remember these key points to diagnose the malignant otitis externa. In your exam, the examiner will give you a scenario that a 60-year-old patient who is a diabetic and he is having ear pain and there is a granulation tissue in his ear canal and there is a facial nerve paralysis. What will be your diagnosis? Your diagnosis will be malignant otitis externa, because whenever there is association of diabetes along with facial nerve paralysis, the diagnosis will be malignant otitis externa. So now we will discuss the separate of malignant otitis externa. Malignant otitis externa can separate anteriorly to temporomandibular fossa, posteriorly it separates to mastoid, medially it can separate to middle ear. This is the separate of malignant otitis externa. Now we will discuss the investigations of malignant otitis externa. CT scan is usually not favorable. Then what can we do? We can do the two tests which are done. First is gallium 67 and second is technetium 99. Gallium 67 can be used to diagnose the disease and can also be used as follow-up. Follow-up plus diagnosis. But technetium 99, it can not be used as follow-up. Why it cannot be used as a follow-up? Because once you have done the technetium 99 test, it will remain positive for 1 year. So we cannot do it for follow-up. It can only tell us there is an infection, but it cannot be used as follow-up. Now we will discuss the treatment of malignant otitis externa. First of all, we have to control the diabetes. Controlling of diabetes is very important, because if we cannot control the diabetes, this infection cannot be controlled. So we will first control the diabetes. Then we will toilet the ear toilet. This will remove all the debris and waste material from the ear. And then we will give the antibiotics. Which antibiotics we will give? Those antibiotics which can kill Pseudomonas aeruginosa, because Pseudomonas aeruginosa is responsible for malignant otitis externa. So which antibiotics can we give? We can give gentamicin combined with tisarcilline. Gentamicin combined with tisarcilline. Then we can also give third generation cephalosporins. Third generation cephalosporins. We can also give quinolones. Quinolones include ciprofloxacin. If the patient is not responsive, then we will do the culture and sensitivity for the diagnosis of bacteria. This prolonged antibiotic treatment has replaced the previous surgical treatments, which include the radical surgery and resection.